all the other medical services that they've claimed in the past that they provide. We've put out reports basically looking at them across the country saying it's just not true. The number one service they provide is abortion. That's it.
Scott, you know what I really hate?
Rhubarb pie.
I wouldn't put that in the really hate
Oh, yeah,
category.
you're from Georgia. You'll eat anything. I forgot.
No, I was more thinking things that I hate are when people intentionally mischaracterize other groups or people. I'm thinking especially about, we read articles all the time lambasting supposedly fake clinics for how they mislead women. They are intentionally tricking women so that women aren't able to get an abortion while it's still legal. They're delaying it, all of these things. And as someone who has worked for a pregnancy center in the past, love the work of pregnancy centers, support them in different ways, I just hate that they are characterized as intentionally misleading women or misleading women at all, when I know the great work that they do.
They're for the pro-abortion people. They've got a target, and right in that bullseye, the number one thing they dislike the most are pregnancy centers. I firmly believe that there is a concerted, coordinated effort from the other side to eventually put pregnancy centers out of business. And we see them going about that in many, many different ways, especially in the dark blue states. It's really terrible. These centers are struggling to survive. But you've got to ask yourself why. Why do they hate the centers so much? Well, I think we've got some answers.
Yeah, I think so. Today we're going to be talking with Karen Czarnecki, the executive director of Charlotte Lozier Institute. She's going to fill us in on a new report that Charlotte Lozier did. I think people are going to be really surprised maybe and at least excited about some of the numbers. Don't worry, we're not going to get too deep in the weeds of numbers and statistics, but those numbers do help paint a picture for us of what's actually happening inside of pregnancy centers, and I think people are going to be really excited to
Before
hear
we
about
bring Karen in, we've got to do all that podcasting stuff.
Oh, yeah.
Yeah, right.
Follow, subscribe, ring the notification bell. Even if you think, here's where it's kind of tricky. You might think because you're watching this on YouTube or it popped up somewhere that you're following us, but it may be that YouTube just knows you and they know you want to
they
see
know you.
these videos. But you may not be subscribed. So subscribe. It helps other people find out about us and get to listen in on these conversations. It really helps us grow and share the truth about the pro-life movement and all the great things happening here.
Karen Czarnecki with Lozier Institute joins us here on Dear Jane. I don't know. What's the transition?
I think you need to start with great job again.
All right. Great job. Karen Czarnecki with the Lozier Institute joins us on Dear Jane. Karen, there have been a lot of talk about pregnancy help centers. Anybody paying attention hopefully understands what kind of pressure they're under from the other side. It's because they're so effective, and we now have some proof to show just how effective they are. Can you tell us a little bit about that?
Yeah, we have been doing at the Charlotte Lozier Institute since 2017 a series of surveys every 2 years to see what their effectiveness, how they've grown, how they're impacting their local communities. And the most recent report we just released about a month ago, and the numbers are astounding. They're reaching their communities. The level of services are up. The satisfaction is at an all-time high. So there's really, really a lot to be proud of. We surveyed 2,775 centers in all 50 states, and I'm happy to share with you some of the information that we found. In 2024, because that's when the data was from the entire year of 2024, 1 million new clients were served, which essentially means every center served a new client every single day. That's astounding.
Yeah.
So they're really meeting the needs in those communities. 8 in 10 of those centers provide mostly free, but sometimes low cost medical services. and they're staffed by 10,000 licensed medical professionals. So for someone to say that they're fake clinics,
Right.
it simply isn't true. In terms of tangible and material support, that has absolutely skyrocketed to a 48% increase over the prior 2 years, and the valuation is at $116 million. It really shows that they're meeting the needs of the local family. So I don't know what you can say, but the best statistic of them all, client satisfaction is at 98%.
Wow.
If you had centers that were not really helping people, you would not have a 98% client satisfaction rate. So there's a
Mis-
lot to be said for that.
Misleading them or not being transparent with them or all the nonsense that we always hear from the other side. I mean, this is just, if you know, I've long asserted it's because these centers are so effective. That's why they're public enemy number one for the pro-aborts. They really, really are. And I think this data kind of tells us why.
Well, they're taking services away from Planned Parenthood. Planned Parenthood is known for one thing alone, and that's abortion. They don't do mammograms anymore. They don't do pap smears. They don't give all the other medical services that they've claimed in the past that they provide. We've put out reports basically looking at them across the country saying it's just not true. The number one service they provide is abortion. That's it. Almost nothing else. Not even STD tests. There are numbers for providing those have dropped dramatically. But pregnancy centers are taking clients away from Planned Parenthood. They're showing people that there are other options other than killing your own child. And if you look at other national research, it says that most people would want to keep their child if they had either financial support or emotional support. Those are the two things that people are looking for. And you're not going to get that at Planned Parenthood.
I'm curious, Karen, because I've done some work at the state level in public policy, and it always is surprising to me how little, at least at the state level, I would assume it's similar at the national level, politicians actually know about pregnancy centers. Do you think that's changing? Are we going to see any sort of support from Congress or even state legislatures based on these findings to say, hey, look, we're always talking about Planned Parenthood, but pregnancy centers are the ones actually doing the great on the ground work for women?
There are some states, and I'm going to find my little cheat sheet here if I can. Out of all the pregnancy centers that we surveyed, 18% of those receive state funding. And from 2022 to 2024, funding has gone up for a number of them. Now, typically the funding is for what they call an umbrella term, pregnancy help organizations. So it's not just pregnancy centers, but that's also for other people doing life-affirming work. It's also for maternity homes and adoption agencies. And there was new state funding that was launched in 2024 in Arkansas, Kansas, Utah, and Tennessee. 5 other states increased their investments in existing initiatives. That was Florida, Louisiana, Oklahoma, Texas, West Virginia. And essentially, this is just telling us they're renewing their investments in the pro-life safety net. So I think there are states that are pretty well informed. Others perhaps are not. But I can also say at least 11 other states continued at the established levels, the program, stable funding for those programs that they had. And I won't bother going to all of those. So if you look at it, states are providing $150 million in 2024 alone for these pregnancy help organizations. So there's awareness, but I think we all could do a better job of showing the good that they do, the fact that they are really connecting individuals, not just to their own pregnancy center, but to other core services that are provided by the state. And they really are those linkages. So they're doing a lot of good in their communities, and they're filling a gap where people can't get those services otherwise.
You know, you're talking about awareness, but and you're exactly right. The more people, elected officials, community leaders, all of us need to be more aware of what the pregnancy centers are doing. But I'll also say a lot of that's on them. And when I first got into the movement several years ago, I was really disappointed. Disappointed. But I understand why a lot of them just wanted to lay real low, right? Not really, maybe talk to their own circle of supporters and that kind of thing. But ever since I've been telling them, as I've been telling the lawmakers, you got to get to know each other. Start telling your story. Help lawmakers understand, because as you well know, there are a lot of pro-life lawmakers who want to fight this fight for us, but they're not equipped with the stories. They're not equipped with the data and that sort of thing. So some of it's on the centers, isn't it, to help equip those who want to help fight the fight.
Yeah, and I'm actually very happy that we partner with so many centers across the country. They use the data from this report that we do to fundraise, to show their donors. They're sharing it with their legislators. But every time that they have a new service, or maybe one of the national organizations donates a new ultrasound machine, they should invite those local politicians, the
Yes.
state politicians in to tour the
Yes.
centers, to meet the clients, to really see what they're doing. I think the more connectivity there is, I think the better outcomes everyone will have.
And if you're really courageous, and I've also suggested this to some pregnancy centers, invite, and if you can find the reasonable pro-abortion people, invite them to so they can see the truth about what's going on at your place. Because they hear all this nonsense, but then and we do have some stories, and we've all heard them of people have gone through who adamant abortion supporters, but they've gone through. It's like this is nothing like what we had heard, and so I mean, there's been this reluctance, but we see the more that they get their story out, the more impact and success they're able to have.
There was a Knights of Columbus Marist poll that was done roughly 6 months ago, surveying people and what they thought about pregnancy centers. And surprisingly, 75% of Democrats said they supported pregnancy centers. And I think it was 80 or 83% of pro-choice individuals, pro-abortion individuals, said that they're not against pregnancy centers if they're helping people. So that message is really fallen on deaf ears in Washington. When you have the Kamala Harrises of the world and Senator Elizabeth Warren basically stating that there's an all-out war to shut pregnancy centers down, they just don't like the fact that they are life-affirming, they're pro-life, and a lot of them are ministry-based. You've got a lot of religious institutions of all denominations assisting individuals because they believe it's their mission to assist those in need. And folks at the national level just do not like that. We've also seen state attorneys general attacking pregnancy centers across the country. There's a case out of California that I know that NIFLA is very involved in. We just heard the Supreme Court oral arguments on December 2nd in the Platkin case, where the New Jersey Attorney General was issued a consumer alert when no one complained, essentially saying that pregnancy centers aren't giving out true information. Well, lockstep, they worked with Planned Parenthood on that consumer alert. And Planned Parenthood, I mean, public documents said they wrote it, they edited it, and they were very involved in all of that. That should not be happening.
Well, and the media is complicit in these narratives too. I think even in the AP style guides and all of those, it's like they're required to refer to these pregnancy centers as fake clinics or anti-abortion clinics. And you look at reports, like actual reports like this, and it just flies in the face of all of their narratives. But if that's all that people see and they hear, I think they pull the most extreme statements or things that they've heard out of, little outlier pregnancy centers or whatever, and then paint the whole movement as that. It really is misleading, but that does impact public opinion. So how do we amplify the reports and the reporting that you guys do so that more people are aware, like this fake clinic narrative is what's fake?
Sharing the reports with elected officials, sharing them with the coalitions. We're in the process of printing a limited number of reports, sending them out to everybody who actually helped us put these the whole survey together. You can download it electronically. It's pretty easy to read, and there are a lot of 4 or 5 stories in the back of the book which talk about how pregnancy centers helped families, helped individuals. There's even a beautiful story about adoption, because a young woman who was sexually assaulted said, I can't raise this child. But now after her child was born, 7 years later, she's got a relationship with the child and the adoptive family. It really is a story that should be told more often. We do need stories, but a lot of times there is shame involved with circumstances surrounding these situations. And a lot of people go through grief. It takes years for them to be able to get over that and talk about it. So when you say we need stories, it's difficult to find stories that are more recent and more fresh, just because people are going through the pain and working through, they're going a lot of counseling in that process.
One of the most important findings, and I don't want to gloss over this, we need to really focus on this. You maybe can tell us the number again. That is that the percentage of centers that have medical professionals, because that strikes at the heart of the number one criticism They want to paint these centers as just a bunch of volunteers, church ladies, and who know nothing about medicine, that sort of thing. And that's absolutely not true, is it?
Well, let me see. 81% of the centers have ultrasound services. 85% percent give prenatal and parenting education classes. 77% give post-abortion support. So even if you've had an abortion, you can go to a pregnancy center and they will give you the counseling and the holistic care that you will not get at a Planned Parenthood or elsewhere. A really interesting statistic too is 31% of those centers are dealing with people involved in who've been victimized by trafficking. 31%. That was an astounding number for me. There's just those are some of the top
Yeah.
numbers there,
But it's so good to see that more and more of these centers have registered nurses on staff. They have MDs on staff. I think the more that we're able to see that, the more that's going to take away that talking point from the other side.
yeah, a lot of the centers have been professionalizing the medical services. 10 years ago, you had a lot of volunteers, and there are still a lot of volunteers, but more than 50% of those medical professionals are being paid. We have someone on the staff here who is a medical director of, I don't know if it's one or if it's three, but that's what she does in her spare time. And I know she does it for free because she's on our staff. There are other associate scholars who are medical doctors who are involved with us who have multiple centers. I don't know that they're paid because they said they've got another job that pays them, but a lot of them want to pay their staff to show that they're real. But what I think a lot of individuals forget is these people are licensed in their home states. You can't say that they're getting substandard care because they are held, if they do something wrong, they could be brought before those licensing boards and lose their licenses. So they're going to take, whether it's a volunteer job or if they're a paid medical staff person of a pregnancy center, they're taking those jobs very seriously.
Yeah, you know, an illustration of that was in Minnesota. And I know that I think it's happened in a couple other states, but at one point there was a bill in Minnesota that would have said if you're a registered nurse and you don't follow the state approved script when it comes to abortion counseling and this sort of thing as it relates to birth and abortion, you could lose your license. That puts these folks in such an impossible position. So yeah, I'm glad you described that and how people are having to be creative because you got a lot of passionate doctors, pro-life doctors and nurses out there that really, really want to help.
I've met a lot of doctors in the last 2 years that I've been here at CLI, and I've met them at conferences. And they're like, well, I've scaled back my medical practice so I can actually do the ministry that I believe in that's helping folks. I mean, it's amazing how if they're nearing retirement, they said, well, now I'm going to help serve the community. And it's just a wonderful thing to meet them because they really believe. They said, I have skills. I may be in my late 60s or early 70s, but I still have another 5 to 10 years, and I'm going to help others.
I love that. The other thing that you mentioned earlier, the part of the report that I love is the client satisfaction, because I think that flies in the face of this narrative that we keep coming up against, whether it's fake clinic or they're harming women. Did you say it was 98% client
98%,
satisfaction?
yes. And in 2022, it was 97.4%. So it went up to 98%. And what really shows is that they're not just getting the medical services, it's the 360 holistic care.
Yeah.
They're getting counseling, they're getting sometimes spiritual guidance, they're getting the parenting classes, they're getting the diapers and the wipes and the baby clothes, and they're getting the sonograms. And a lot of them have made friends for life. A lot of the individuals who work at these centers keep up with people for years to make sure that they feel welcomed and that they're meeting the needs that they have. I think that's why the satisfaction rate is at 98%.
And I think it's worth highlighting because, the other side always thinks, well, the woman's main problem is she doesn't want to be pregnant or she has all these other extenuating circumstances. So she obviously needs an abortion. And it's like, well, what if we address those extenuating circumstances? Planned Parenthood is never going to do that. Abortion clinics are never going to do that because it doesn't help their bottom line. And then on the other side, you have pregnancy centers that are not in it for a bottom line. They don't profit off of women needing their help. But you see them addressing women holistically and meeting it's not just the fact that a woman is facing an unplanned pregnancy. She has a whole other list of issues that are causing her to consider abortion. And so it makes sense that women would feel highly satisfied after visiting a pregnancy center, because it's not a one and done thing. It's like you say, they often do develop relationships that last a lifetime. So I just think that's remarkable, and that's something worth celebrating and worth talking about more broadly.
Absolutely. I agree with you.
So when you think about, we were talking earlier about lawmakers and helping them understand the impact. One of the hurdles is, and we've seen this in a few different states where we've had lawmakers who want to help, whether that's through a grant process or that's, tax credits, that sort of thing. But there's a lot of hesitancy on the part of the centers to receive any kind of government help whatsoever. So what's some effective things pro-life lawmakers can do, and we can encourage our lawmakers to do on behalf of these centers?
Well, I think to address the concern, because a lot of the pregnancy centers have a spiritual relationship or a spiritual connection with a number of churches, they do not want the government coming in and telling them what they can or cannot say to individuals. I think that's why there is some fear that if they accept government grants, they'll have to follow whatever the government agencies or the government regulations are that will impose limits on their ability to minister as they see fit. So sometimes I think the fear is real, but at the same time, they have religious freedom, they have freedom of speech, they should be able to do that. And if you look at any one of these pregnancy centers websites, they say we are a ministry, we are a faith-based or a life-affirming. I mean, they're not hiding who they are. And if people want to avail themselves of that, I think that's okay. We have we've got a paper, and I can't quote anything from it today. There are a number of states that have alternatives to abortion, basically state-funded programs where you can get assistance, whether it's from a pregnancy center or other things that states can do. And we're seeing more states interested in those and expanding those options. So I think if lawmakers wanted to look at maybe not just assisting pregnancy centers, but doing other things with their state programs, especially grant programs that come from the government, making those more amenable to people who are not just poor, but in dire circumstances. I mean, connecting the dots and making the funding streams easier to access, I think would be a really, really good thing. And I know there are a lot of individuals who can assist with helping lawmakers to do that.
Yeah, and the argument I make to lawmakers is it's kind of the benefits of a public-private partnership that you see, and you have it in business all the time. You make a small investment in some of these private entities that really benefits the public in a large way. Well, another thing I always encourage center directors to do is help your leaders understand the impact you're making on the community, how you're easing the strain on the social safety net in some cases with all the free food and the diapers and whatever it is you're doing. Again, it's just making sure that people, these centers especially, we've got to help them and encourage them to tell their story.
Well, in terms of evaluation of services, I want to just I said, how did you come up with $452 million in savings for the taxpayer? And it's a really conservative estimate. It could be more than double that. And they did an average cost of diapers, wipes, car seats, strollers, whatever they give out at the centers. And they took the Walmart prices in not rural America, but middle of America. And if you're living in Washington, D.C., or you're living in Scottsdale, Arizona, or if you're living in parts of California, Walmart prices there are going to be 20 to 30% higher. But they took a super conservative estimate of these services, and they use that we don't want to be told by anybody that we're inflating these numbers. So 452 million in 2024 alone is extremely conservative.
One of the stories that is in the report is about abortion pill reversal. And this is something I still think even a lot of pro-life people are not aware of, or maybe it's because they don't understand how the abortion pill works, which is actually 2 pills, that then they're like, how can there be abortion pill reversal? Can you speak to that a little bit? Are more pregnancy centers starting to offer this? Or if not, what's the barrier to being able to do that?
29% of pregnancy centers offer abortion pill reversal. And that is up roughly 10% from 2 years prior. So it is becoming more widespread. And I think the abortion pill reversal network said as of June of 2025, 7,000 children had been saved
Wow.
using APR.
Wow.
I think what most people don't know is it is a 2 pill regimen. If you take the abortion pill and you said that was really the wrong thing, or I was coerced, or I'm having second thoughts, you can actually go and be seen for abortion pill reversal within 3 days. It's 72 hours by taking that. Though I don't even know what they do for that. I mean, I don't know.
Like
I
high
think
dosage
they give you progesterone. It's a
progesterone.
high dose of progesterone, um, and there's a 64 to 68% chance of saving that pregnancy. So it's not going to be successful in 100%, but 64 to 68% is pretty high. I mean, so there's a good chance you'll be able to save your child. I think one of the stories said that after someone took their first abortion, the abortion pills, she went and had an ultrasound, and that changed her mind. That's when she said, I need to change this course of action because I made a bad decision." So I think APR, we do need to talk about it more. The California litigation that's going on right now is trying to shut down Heartbeat International centers, saying that this is not true, and you shouldn't be advertising this. 7,000 babies says it
Say
does work.
otherwise. Yeah.
You know, this is what's always befuddled me. And as Marcie could tell you, I'm easily befuddled. But okay, so on the one hand, we understand why Planned Parenthood hates these centers because it cuts into their profit, right? So as heinous as that is, you at least understand where they're coming from. I've never understood the opposition to APR because it's not impacting that. Basically, a woman has changed her mind. She's making a different choice, like you said. She's like, "Oh, didn't want to do that. I didn't, I regret doing that." I've never understood the vehement opposition to this because, as far as I can tell, it's not cutting into their profit margins. So why do you think they are so vehemently opposed to that?
Because it's connected to pregnancy centers, because it's successful, and because they know it. I mean, the number one thing that Planned Parenthood is doing now, it's not doing surgical abortions. They're giving the pills out. 63% of abortions in America are taken with the abortion pill regimen. And Planned Parenthood, including Planned Parenthoods who do telemedicine, are distributing those pills. So it will cut into their profits if people can basically change their mind. It won't complete the process. And it will probably discourage people from going to Planned Parenthood again. It's all about money with Planned Parenthood.
Yeah.
It's undermining their business model.
I wonder too if there's a component of they don't even like the possible promotion of a narrative that women might regret their abortion. And an abortion pill reversal does that.
It's probably true. There are studies that say a majority of people who have had abortions would have made a different decision. They felt coerced, they felt pressured, and even I think 60% of women say abortion was not even part of their value system. But were it not for the coercion or the pressure or the real concern about their life circumstances, they would not have chosen abortion.
When you guys are out in the field surveying these thousands of centers, one of the big hurdles I have heard about is just that there's not a lot of uniformity, and we know that there's not. I mean, some centers are open one day a week, some are open. That's why when you talked about it averages every center serving one person a day.
A new client every day.
A new
yes.
client every day. That's a big deal because a lot of centers aren't open, certainly aren't open every day, let alone every weekday. So that's pretty significant. Are we starting to see a little bit more uniformity in some of the services being offered?
Yes, and as a matter of fact, some of there's some nationwide network of organizations who give grants to a lot of the pregnancy centers so they can expand their hours and serve more clients. And that's been happening over the last 8 years that we've been seeing this. So the majority of them, I don't know if they're open 7 days a week, but they're open a good portion of the week.
That's incredible. There's so much in this report that people need to hear because it just flies in the face of all of the narratives that are out there. We're so grateful for the work that you do at Charlotte Lozier Institute. Will you tell people how they can learn more about the work y'all do? Any upcoming projects that you're working on that you want people to know about and where they can find you?
All of our research, whether it's peer reviewed or just put out by the Charlotte Lozier Institute, is on our website. So it's lozierinstitute.org, and you can find this pregnancy center report and download it. It's roughly 48 pages. But I would just do the charts and graphs. You don't need to just read it online. You don't need to print it all. Don't waste all the printer ink. But in terms of other reports, yes, we've got some really exciting stuff in the peer reviewed category coming out. One was just public pregnancy outcome sequencing. We had two statisticians from California asked to work with us. So we gave them a data set, and they worked with a couple of our other data analysts, and they are looking at the entire. I'm going to try to simplify this: the entire woman's entire reproductive history, and based upon a first loss, whether it's by abortion, a miscarriage, or a live birth, whatever happened that first one, I'm not allowed to use the word predicting. Their analytical model is showing what the future pregnancies might look like, and really if it will result in a future loss. So that study was just published, and the next one is looking at abortion and mental health. For having a first abortion or birth, or what the impact is on mental health. We're going to prove it with the numbers. So it's kind of complicated, but in the world of science, it will mean a great deal, and it will be very threatening to the other side.
Yeah, let me know when the graphs and pictures are out so I can. That's how I can absorb.
Of course.
That last report will be very helpful because we know, just anecdotally, you talk to women, whether they feel the impact of it right away or it's decades down the road. Certainly, they're anecdotally, at least, there's mental health components to that. So I'm really grateful for the work that you all do, keeping us educated and everyone else educated as well. We got to push back against the mainstream narratives, and you guys give us the data and the numbers to be able to do that. Karen, thanks so much for joining us today.
Thank you. I appreciate it.